To begin, let us acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. We thank the Indigenous peoples of this area for their care of their land for thousands of years, and we hope to honor and respect them as we hold our virtual event today. I'd also like to take this moment to personally thank you for everybody for joining today's presentation, and have to note that this is the highest attendance we've had for all of our virtual presentations over the last few years. So again, thank you, Dr. Ogden, for bringing us the audience today. Our speaker this afternoon is Dr. Nick Ogden, who will be presenting on behalf of his research team on the topic Lyme disease emergence with climate change. What will be the economic burden for Canada? Dr. Ogden is a UK-trained veterinarian with a doctorate in vector-borne disease ecology and postdoctoral training in disease modeling. He is a senior scientist and the director of the Public Health Risk Sciences Division within the National Microbiology Laboratory of the Public Health Agency of Canada, normally focusing on assessing disease risk by the study of the ecology, epidemiology, and genetic diversity of vectors and zoonotic and vector-borne microorganisms. A key component of his work is assessing impacts of climate change on zoonosis and vector-borne diseases and developing tools for public health adaptation. Most recently, he led the Public Health Agency of Canada's COVID-19 modeling and emerging science teams. We will have Dr. Ogden present, and then we will open for questions from the audience. You can ask your questions by entering your questions in your chat box, or you can raise your hand icon during the Q&A segment. Please help me welcome Dr. Nick Ogden to the podium.
Okay, thank you, Veronica, for inviting me to speak. And I'm sure that it's not entirely me who's drawn the crowds, but my collaborators on this work. Just check it, trying to get it into full screen.
It should pop up in a second. There we go. There you go. Perfect. You're good to go.
Okay, thank you. So just to underline the key role of this work, I'm kind of a bit of a talking head today, recognizing that a lot of the heavy lifting on assessing the impact of climate change on incidence of Lyme disease has been kind of the work of my colleague, Dr. Ariane Dumas. The economic analysis by Dr. Ellen Rafferty, Institute of Health Economics, and the climate modeling that underpins the work by Dr. Philippe Gachon at Université de Québec à Montréal. So looking at Lyme disease emergence with climate change, what will be the economic burden? I think as many of you will have seen these kind of graphs, that was work that was done from kind of 2006 to 2008 to produce these projections of what might happen with climate change and the spread of Ixodes scapularis, and by inference, Lyme disease risk, which has been repeated using more up-to-date climate models and greenhouse gas emissions scenarios, or RCPs. And I think as we use now multi-model assemblages of climate models, and the predictions are consistent across those assemblages. And as we know, Lyme disease is emerging in Canada, associated with the spread of the tick, or mostly associated with the spread of the tick. So we're seeing not quite, but almost an exponential increase in the number of cases. So this study looks at the future cost of Lyme disease in Canada. Of course, there are many uncertainties in this kind of approach, but I'll try and cover them as best I can. So I think increasingly the economic cost of diseases is becoming an important determinant and an important piece of information for developing policies. So the following questions we wanted to know: one, how will the climate change in Canada? And we used a stepwise approach to be able to answer that question about how much it will cost. So how will the climate change? As a cause of that, where will the ticks and Borrelia burgdorferi by inference spread to? How will Lyme disease incidence increase? And then how much does a Lyme disease case cost in Canada? The study area that we chose for this, we chose to limit it to the impacts of Lyme disease east of Saskatchewan, with the assumption, which may not be ultimately proven to be correct, that the woodland habitats west of Manitoba may not be suitable for survival of the tick. Certainly many uncertainties there. And it also excludes regions where the forest is boreal forest. Again, we're making an assumption here that the boreal forest will not be suitable for ticks, but that may turn out not to be the case, and is certainly something we'd be interested in studying. The economic costs estimated are healthcare costs and productivity costs. We also measured disability adjusted life years, and in general, the disability adjusted life year in a developing country, or sorry, a high income country like Canada could be equivalent to about $70,000. But usually there is real costing of dailies more when there is the disease is causing mortality, and we're not considering here that that the disease is causing mortality. We also assume that there's no post-infection immunity. In other words, people can acquire infection again and again. I think there is some evidence that people can be infected multiple times due to strains, diversity, and being infected with heterologous strains. But obviously there may be some limits ultimately to that. So the first part of the first question is, how will the climate change? And to provide a surface of climate for Canada from a recent current climate, in other words, 1995 to 2021, we used what's called the ERA5 or ERA5 global reanalysis data. And what these are is essentially the data observations that are then interpolated in time and space using a modeling method. And these are the sort of gold standard methods used by World Meteorological Organization. The index for survival of the ticks is the annual mean annual cumulative degree days above zero. Essentially about 2,800 degree days above zero is the limit. For 2022 to 2100, a multi-model ensemble from the North American Codex program was used to project those degree days above zero, a 25-kilometer resolution for the future. These new models are capable of producing a value, at least for degree days above zero, a value for each year. Many of you will be familiar with the climate change modeling, which has looked at future time slices, but now the models produce a kind of an annual value, at least for degree days. Within those futures projected in the climate modeling, there's obviously uncertainties. And there are uncertainties about the greenhouse gas emissions, which, and here we're using what are called the RCPs, representative concentration pathways, 4.5 and RCP 8.5. 4.5 is optimistic in that we get control of our greenhouse gas emissions. RCP 8.5 is pessimistic in that we don't really get a good control of our of greenhouse gas emissions. So that's the greenhouse gas emissions, but there's also an uncertainty about that, of course, but there's also each model of the ensemble is a possible correct interpretation of what the future may give, and there are variations amongst the models for a variety of reasons. And so for each RCP, we are using 3 modeled outputs, so that the most pessimistic model, the most optimistic model, and then a mean of the model ensemble. So in other words, there are 3 models values for each of the 2 greenhouse gas emission scenarios. So where will the ticks spread to is the next step. That's the essential step for people to acquire Lyme disease. As I mentioned, the estimate we're using is 2,800 degree days above zero. We're unit of study of the human population is census subdivision. And when a census, we're assuming here that once a census subdivision becomes climatically suitable for ticks in the past or in the future, it's assumed that the ticks from reproducing tick populations will be present 2 years later. So that's about how long it takes for the ticks to be starting to appear in the environment, and that once the tick populations are established, the significant risk from Lyme disease begins about 5 years after that, as the transmission cycles begin. Once a census subdivision becomes suitable and a tick population has set up and Borrelia-Burgdorferi transmission cycles begin, we assume that the incidence of Lyme, that each census subdivision will go through this Lyme disease emergence phase, and the incidence will increase at a similar rate as we're seeing nationally at the moment. There are clearly some reasons, which I'll discuss later, why that might not be the case, but that's the assumption we're making at the moment. The increase will continue up to one of 3 maximum incidence values, and that is when Lyme disease is fully endemic in that census subdivision. And the 3 levels are the pessimistic incidence, which you see on the red line at the top, which is the maximum incidence amongst US high incidence states, which is in Vermont. The optimistic incidence, which is the average incidence in US high incidence states, which is the green line, and then a medium incidence, which is midway between the 2. We assume that the incidence seen in these states these high incidence states is what we may reasonably expect, because those are the states that border Canada, and there's no reason to suppose we would not end up with an endemic transmission of Lyme disease, which provides similar risk to that occurring in those states. And we certainly do have in some locations, locations where the incidence is even reaching the pessimistic incidence. We also take into account here that the reported incidence of Lyme disease in the US is only about 1/14 of that is actually occurring based on the studies conducted by colleagues in CDC. So how will Lyme disease incidence increase? And here you see graphs, which you will see a number of graphs like this, which showing at the top the results for the RCP 4.5 optimistic or more optimistic greenhouse gas emissions scenario, and the RCP 8.5. And for each of these, you'll see there are three groups of graphs, three groups of three graphs in each of the graphics. So, and you can see straight away that the biggest kind of variable here, the one that has the biggest effect, is whether we consider pessimistic maximum incidence, medium, or optimistic maximum incidence. And within those, there are three, in each of those, there are three graphs for the maximum, the minimum, and the mean climate model output. And so you can see that the incidence is, it ranges from, by the 2100, between 127,000 cases a year to 580,000 cases a year, which is a lot. And that with the RCP 8.5, in both cases, for RCP 4.5 and 8.5, really the maximum's almost been reached by 2050, and that it doesn't change much after that. And we'll come back to that. So, and you can see here the regions affected according to the algorithm we developed. And I must say this is an algorithm for the spread of the tick and the increase of Lyme disease cases. And we are working with colleagues to look at a more dynamic modelling approach to model the spread of the tick and Borrelia-Burgdorferi and Lyme disease risk. But that's for another day. So how much does a Lyme disease case cost in Canada? And this is the work of Dr. Ellen Rafferty. And we are using a percentage of total Lyme disease infections based on a number of studies, including that by Todd Hatchett for Canada. And that there are approximately 16% are asymptomatic, undiagnosed, maybe self-resolving. About 26% are erythema migrans, 41% are early disseminated, and 19% are late persistent. Some will notice that we don't have any data for post-treatment Lyme disease. And the reason for that is that there have been no studies, as far as we're aware, that costs those out. And certainly, while we have on the right-hand side, you see the costs of the cases which come from studies in the US and in Canada, that that actually really reassessing costs per case is a work in progress. So looking at the RCP 4.5, you can see quite significant and the values on the y-axis is in millions of Canadian dollars. So reaching up to somewhere between 75 and 350,000, 75 and 350 million dollars a year for healthcare costs, and somewhere between 400 and about $500 million to 1.8, sorry, $500 million to 1.8 billion a year in productivity costs. And again, very similar values for the two greenhouse gas emissions scenarios. Dailies, again, up to 70,000, somewhere between 15 and 70,000, depending on the different maximum numbers of cases at endemicity. When we look at where the costs are coming from, in terms of what type of cases are causing most of the costs, well, early disseminated, but late persistent are obviously having a quite a significant impact. And a lot of the impact is actually not healthcare, it's productivity costs. And when we're looking at the disability adjusted life years, then again, early disseminated, but the biggest impact is for the late persistent, obviously, because those people are having they're having a longer term illness, which is affecting their capacity to work and undertake leisure. So the total costs, excluding leisure, excluding dailies, is between $500 million and $2.3 billion a year. So some pretty substantial costs. The question, of course, as I've been mentioning all the way through these results, is why is there so little difference between the RCP 8.5 and 4.5? So where's the benefit of us tackling climate change? Well, I think the answer to that for Lyme disease in Canada is that probably not a great deal, except for those perhaps in the boreal forest or who are further north, if those habitats are suitable for ticks that transmit Lyme disease. And the main reason for that is that there is little difference, is that really under both those greenhouse gas emission scenarios, temperatures increase similarly for the two up until 2050. And the reason for that is because the CO2 hangs around quite a long time in the atmosphere. So any effect that we have now on reducing greenhouse gases is not going to kick in for some time. So it's only after 2050 do you see the temperature changes diverging for the two emission scenarios. So, and secondly, most of our population is living in areas where the under both emission scenarios, the ticks move in by the 2050s. So the upshot is that the pretty much all heavily populated census subdivisions in Canada will have suitable habitat for the ticks and endemic transmission probably before the 2050s, and that any difference between the RCPs in the future would likely have an impact if the boreal forest can support ticks and transmission cycles. We have gone back and had a look at to see how this algorithm for tick spread and increasing cases actually how that actually concords with what we're seeing. For Manitoba and New Brunswick, it seems to be about right. For Nova Scotia, it's very much underestimating the number of infections, or sorry, number of cases, and this is reported cases. For Ontario and Quebec, there is overestimation of the rate of increase in cases compared to observed, and that means that perhaps these estimates are somewhat overestimates, because obviously the populations of Ontario and Quebec are the largest in the zone of study. One possible reason for this that we're exploring is that, and these are Earth observation risk maps for Ixodes scapularis, which include habitat, and you'll see there are different grades of climatic suitability, and this is for 2012. for Ixodes scapularis, according to that 2,800 degree day limit. And the blue area is not currently suitable for tick populations to establish. Doesn't mean there may not be adventitious ticks that appear there, but not reproducing populations. And the kind of hotter the color, the better it is for the ticks. Except, as you can see, there are, for the brown areas, which is where the habitat is not suitable, because if you've got a suitable climate, but just a field of corn, you're not going to get tick populations setting up. And we can see that in southern Quebec and southern Ontario, some of those regions where the populations are setting up are in fact has a lot of unsuitable habitat. So that might do two things. It might reduce the probability that people encounter ticks, or it might be slowing the spread of ticks, particularly by and possibly Borrelia, by terrestrial hosts. So to conclude, the projected numbers of Lyme disease cases are somewhere between 120 to over 500,000 a year, depending on the scenarios. By and large, the increase it goes up linearly until 2050, and then it's pretty flat with very little in the way of increase to 2100. Projected costs of Lyme disease are somewhere between 0.5 to 2.3 billion a year. Again, the biggest impact is, well, how high does that incidence get? And with somewhere between 12 to 70,000 dailies a year by 2100. Little difference between RCP 4.5 and RCP 8.5, as the study area is almost entirely suitable for ticks by the 2050s, and both scenarios produce pretty much the same warming up until the 2050s, after which the warming levels out under RCP 4.5, but continues increasing with RCP 8.5. The validation suggests there is interprovincial variation in the rates at which Lyme disease is emerging at present in Canada, with under and overestimation of incidence in different provinces. It may be due to habitat differences amongst the provinces in the most southern and immediate regions of Lyme disease emergence, but there are other plausible explanations, including interprovincial differences in underreporting and proportions of the population that are urbanized and may or may not be exposed to or have different probabilities of encounters with ticks. So I'll stop there and ask if there are any questions.
Thank you so much, Dr. Ogden, for your discussion today with the group. I'm going to look. I don't see anything in the chat box right now typed out as far as questions. So I am going to open it up, and I see Dr. Kadar has a question. So go ahead, Dr. Kadar.
Dr. Ogden, thank you very much for this brilliant presentation. I wanted to point to the fact that actually we have all the clinicians that are taking care of patients that have Lyme disease or post-treatment Lyme disease or lingering symptoms after an infection, that there is a tendency of under-reporting. So I have difficulty understanding your appreciation of the comparison between your modeling and the actual data available. Is it really overestimation, for example, for what's happening in Quebec in terms of incidence, or it's just that our capacity to detect adequately Lyme incidence is under evaluating evaluating what's happening really in the ground?
Yeah, I think that is a question that we need to keep on evaluating what is happening with in terms of the proportion of cases that are the proportion of cases that are reported is a question. We have estimated that in the early stages of the emergence of Lyme disease, somewhere in the order of about a third of cases likely were reported. But and that is within a fairly tight surveillance case definition, which so some quite a high bar in terms of that case definition. So in some ways there may be overestimation here of the numbers of cases in the future, because maybe there are things that are going to slow the spread of the ticks or reduce the contact with people that we're not looking at as we see the data from Ontario or Quebec. But there may be some underestimation for reasons that you mentioned, and certainly we're not here counting anything for post-treatment Lyme disease syndrome.
Thank you for the question. So I do have a two-part question in the chat box. The first is just confirmation. The $2.3 billion you mentioned in your presentation, is that today's dollar, correct?
I think it is, but I would just, I think Ellen Rafferty is on the line, and maybe Ellen could maybe just pop something in the chat to answer that one, if she can do that.
Yeah, I'll just unmute because it seems easier. But yeah, so they're 2023 Canadian dollars. We did not account for any sort of inflation or anything like that in the estimate.
Thank you. And the second part of the question is, are the habitats identified in Ontario and Quebec that are not suitable similar to Saskatchewan, informing the assumption that Saskatchewan may not have suitable habitat?
No, it's not quite as comparable as that. The unsuitable habitats in Ontario and Quebec are those that without woodland. We're assuming that unless there's woodland there, the ticks cannot survive because it's too hot in the summer, it's too cold in the winter, and there are no or there's not enough high density enough of hosts for the ticks to survive. So that's, sort of open agricultural land, maybe urban areas, and so on. But the assumption about what's happening in Saskatchewan, we just make an assumption that all of the habitats, including the woodlands, are not suitable in Saskatchewan. And so we're not actually we're not including spread of ticks and Brigadier Bugdorferi into Saskatchewan. That is an assumption which may ultimately prove to be incorrect.
Thank you. We still have some time for questions. Does anybody else have a question and wish to unmic and ask your question to Dr. Ogden?
Yeah, I have a question.
Go ahead, Dr. Bordeaux.
Yeah, great talk, Nick. Really enjoyed it. I was really interested to see that you said that Vermont has the highest incidence of the states in the US. And I guess, seeing how it was discovered in Connecticut and I would have thought New York and those states that have had higher incidences. So has that been changing in the states? Like, I mean, have the US researchers been documenting that?
Those are data from CDC. Those are reported cases for CDC.
Right, but do you know if it's been changing? Like, did New York used to be the epicenter, and now it's more northern states?
I would have to go back and have a look at that, Martin. I would have to go have a look at that. Okay. So yeah, but certainly in the northern states there has been increasing Lyme disease. I mean, we've seen this in Maine, particularly, right, with a lot of discussions with the folks in Maine, and certainly Maine has really been documenting kind of northward spread of that we have seen as well, sort of, so northward and eastward spread in Maine. So
Okay, I see Jean's got her hand up, so she might tell us about the situation in Michigan.
thank you, Jean.
Hi, it's so great to hear your talk. I'm sorry I missed yours, Dr. Voodoo, last week, but I hope to get a recording. But I was not really prepared to answer Martin's question, although that I should say that I think it is the case that some of these leading in areas of invasion that they have had higher incidence. And I don't know if it's a mixture of reporting or what, less people know about the disease at the edge, and so you're getting higher. I'm not sure, but they have robust cycles, I think. In Michigan, we're still a low incidence state in many places. But my question actually was, I would just love to hear your thoughts, Nick, on whether or not the modeling you think will increase the cases of some of these other tick, Ixodes scapularis-borne diseases, more than just maybe due to having greater numbers of ticks. But do you think, for instance, out here in the Midwest, that the life cycle will change a little bit more and it'll decrease or increase the potential for short-lived pathogens, short-lived in the host, to amplify or actually decline? Any thoughts?
It's something that we like to look at and in more detail, obviously, because as we have discussed, the more seasonal synchrony of nymphs and larvae in the Midwest should be, or upper Midwest should be as in Manitoba, should be and probably Northwest Ontario should be favoring these transmission of pathogens that are generally shorter lived infections or shorter lived periods of high transmission during for things like Babesia and Anaplasma and so on. So that should be, and I think we have initially seen that there was some evidence for that in terms of Anaplasma and Babesia in Manitoba compared to other locations. But more recently, we have seen in some places, such as in southern Quebec, where there has been really quite high levels of Anaplasma prevalence in the ticks. I'm not quite sure where we are now in some of those locations, but those high prevalences make we wonder if we're not seeing a sort of surge in infections associated with a highly naive reservoir host population adding to that dynamic. And so again, it'd be interesting to be studying these diseases. Although obviously it means you have to get many more ticks with
right.
small prevalence.
That's right. Thanks.
Thank you, Jean, for your question. Dr. Qatar, go ahead.
Yes, I was just wanting to react to the incidents in the states in US. I have been revising those data for a few years now, and I can say that at least for the past 7 years, Vermont, Maine, and New Hampshire are disputing one another the first rank among the US states in terms of incidence, somewhere between 100 and 120 cases per 100,000 per year. And they are now surpassing the historically high incidence states like Connecticut itself, Pennsylvania, Maine, and I say Maine, I mean New York and New Jersey. So we are seeing, of course, an incidence that is where the epicenter of the incidence is moving northward constantly since the last 20 years. So for that reason, I'm not at all surprised by the projections of Dr. Ogden in terms of considering that Quebec and Southern Ontario will soon be, if they're not already, among these high-ranking incidence rates.
Okay, I should have said that if you want to ask questions in French, please do. There is a question in the chat from Rob Murray about the case definition And I think we have had a high bar case definition in order to be sure that we're capturing Lyme disease cases, so that can be interpreted. Changes can be most from one year to the next, from one location to the next, can be most confidently attributed to changes in transmission patterns. Quite often that is the case for surveillance, that you're not there to capture every single case. As we can see that from the studies in the US, that it's actually quite a small proportion of the cases in the high incidence case states that are actually captured. So, you know, we're aware of that. We are, I say, including in this an assumption that the underreporting in the US is the same as or will be the same here too. But again, there's uncertainty about that. We recognize that strains vary across Canada. That may be associated with varying disease types. It may be associated, but it could also be associated with some that cause more frequently self-limiting and sort of self-recovering illness too. But that's definitely something that is a kind of focus of research. And we also recognize that there are other bacteria out there, Borrelia miyamotoi, Mayonii, and the anaplasmas and Powassan and Babesia, which we are not including in this analysis. Yeah, I think that indeed Lunenburg, Nova Scotia is it does have a very high incidence. It's true.
Thank you, Rob, and thank you, Dr. Ogden, for responding to that comments. I see Dr. Coatsworth has her hand up. Please go ahead.
Hey, Nick, great talk. Just wondering what you think, or how you think the economic landscape would change if that phase 3 vaccine that's in the US right now was approved by Health Canada and kind of had a rollout here in Canada.
Well, I think that it would have a big impact, dependent on vaccine uptake and effectiveness, of course, but it has the potential to have a huge impact. Yeah. I mean, we have to recognize that the incidence we see in the high incidence states is what is seen with the public health measures that are in place, which it gives an idea of to the degree to which our public health toolbox could do with some additional kind of power.
Awesome, thanks.
Thank you. A couple more minutes left. Is there any additional questions for Dr. Ogden? Or any follow-up questions to some of the questions that have already been asked today?
I have one quick question for Nick. I was wondering, so we're seeing it spreading northwards. Is there any evidence that in the warmer states that Lyme disease is disappearing, like in Virginia, or
actually, no. What we have to bear in mind that the distribution of Ixodes scapularis is quite complex in the US because there are different kind of genetic groups. And those genetic groups that are associated with that bite people readily and that have high prevalence are those that are occurring in the Northeast and Upper Midwest. But and I think there's an assumption that we have reached kind of max in the US, but actually, as my colleagues in the US are telling me that the ticks are actually still spreading out of their kind of refuges within which they've been, and that includes spread north, which may be associated in part with the effects of a warming climate, and we've got a lot of evidence to support that for the emergence in Canada. But the ticks are also spreading south, so they're also spreading into Tennessee. So they had Ixodes scapularis there, but they were the ones that were not biting people, but they're seeing the human biting versions spreading into them, and I'm just trying to think, North Carolina, I think. I would have to have a look at a map, but there's definitely, if you look at the changes of the distribution of the ticks in the US from the 1998 distribution developed by, I'm trying to think of the name, but you can see it on the website. They actually have an animation that's showing how the risk or the occurrence of the ticks has changed, and Lyme disease cases has changed, and it's clear that there is southern spread as well as northern spread.
Okay, thanks a lot, Nick. So yeah, pessimistic scenario then, no let up anywhere. Thanks.
Yeah.
Thank you. Okay, one last question before we close out for today. Let me just look in the chat box and see. Okay, there's two questions. One is, thank you, Dr. Ogden. When will the other common TB infections be reportable diseases for tracking the epidemiology and included in the testing as a matter of course? Also, how might we integrate the veterinary data into public health dashboards?
So for the first one, I know it's a work in progress towards including at least Anaplasma, Babesia, and Powassan, I think, as nationally notifiable diseases. So that's still on the way. I'm not quite sure, because I've not been involved directly in the process, how long it will be until they are reportable. The idea that we integrate veterinary data into public health dashboards is, again, I guess to some extent that has happened, not in terms of Lyme disease, but at least in terms of ticks, that our initial passive surveillance for ticks included ticks that were coming from veterinarians. And also, of course, ETIC, as we'll find out tomorrow, there is this is about collecting ticks from they're feeding on people, but also on animals too. So.
Thank you. And the other question is, passive surveillance of ticks, including Ixodes scapularis, are being reported on an ongoing basis across Canadian provinces bordering the US, including Saskatchewan. While we know there's a delay in these ticks harboring pathogens, does it support a claim that findings, particularly the data presented, might be an underestimate of the incidence in Canada?
I think there's two parts to that. Is the underreporting is what exactly the mechanism of underreporting is unclear. The initial studies that were done in the US supported the idea that early in the emergence of Lyme disease, it was kind of lack of awareness of necessity to report amongst practitioners. But probably now it's just simply that the physicians see so many cases that they just do not have the time to report them. So that is, and possibly don't feel that it adds much. We already know we have Lyme disease here. So, and I speculate a little bit about that, but that's probably the underlies the underreporting now in those high incidence states. But we certainly do get the possibility of, even when environments are suboptimal for the ticks, for a migratory bird born tick that is dropped off to actually complete the molt and then quest again and infect people, and so there is the possibility that under those circumstances that those cases might not be captured, but again, that's a bit of a speculation.
Thank you. And one final question for today, and I apologize if I'm not pronouncing it right. Babesia odocolii is the strain found in Canada. Is this being
this-
tested at the National Microbiology Lab?
The Babesia odocolii is I have not been studying this in detail, but there is my colleagues at Winnipeg and other colleagues here in Quebec have been looking at this in detail. And so this is a very common Babesia. It's a Babesia that affects that infects deer, hence the name. But there is no evidence that it causes human infections.
Thank you. Well, I do want to thank Dr. Ogden and his team for this presentation today. I also want to thank our audience for all your questions. I just wanted to let you know that we are continuing our discussion this month. Tomorrow, Dr. Jane Savage is presenting on 5 years of ETIC data, highlights and outlooks. So we do hope you can attend. It's at 1 p.m. Eastern time, Tuesday, May the 9th. Also, a reminder, please take part in our challenge. Wear green, take a photo and share it with us to help spread awareness of Lyme disease and tick-borne diseases. You can also send photos of your creative artwork or drawings that also express to you Lyme disease and tick-borne disease awareness a month. All photos received will be automatically entered into our draw of one of 4 $25 e-gift cards, which the draw will occur on our last day of our presentations on May 31st at 1 o'clock. So send your photos in to clydern@gmail.com along with your name and email. And finally, we will be having our in-person scientific symposium, TICNET Canada, in Toronto, October 24th and 25th. Registration abstract submission will be opening soon, and hopefully before the month's end, we will be able to share more details about you. What is TICNET Canada? Well, a number of our researchers of our current network are expanding and creating a new network called TICNET Canada, which will have a lot of colleagues and patient partners across this country that will look at Lyme disease as well as other tick-borne diseases. So we're kicking it off with a scientific symposium in the fall, and hopefully you'll be able to join us. Again, I'd like to personally thank Dr. Nick Ogden and his team for taking the opportunity today to sit down with us and go over his talk. I also appreciate the audience today for joining us today and answering all your questions. I hope everybody has a great rest of your week and can join us throughout the rest of the month in your presentations. Take care, everybody, and have a great day.
Bye.